I'm a mental health nurse, and my clinical specialism was always supporting people who were experiencing really high levels of distress because of their illness. And it was when I was running a secure unit in Gloucester nearly 20 years ago that I really first became passionate about green therapies and the opportunity that they provided for really doing things differently. In the leadership role I have now, I'm responsible for the full range of mental health services, so everything from the primary care interface right through to medium secure services and all of the specialist services as well. One of the things that I'm really passionate about is finding the best interventions to provide the best experience and the best clinical outcomes for people who use our services. And I was really excited when a couple of years ago I was given the opportunity to become involved in the leadership of the Green Social Prescribing Programme and our role in BNSSG as a national pilot site. Green social prescribing is incredibly effective at offering something to everybody, no matter what they're going through at the time. These types of interventions are really what we like to call scalable, so they can be delivered in a really low-key, straightforward way, right through to providing complex interventions for people in hospital who've got a really high level of need. We've got some amazing work happening in Bristol, so with Bristol Mind, working at St Werburgh City Farm.
One of the benefits for us and other charities working collaboratively with AWP is we can present our activities and what's on offer to the Hope Service and to the recovery coordinators, and then they subsequently can support us with increased referrals and work collaboratively in the benefit of the service users. One of the advantages for Bristol Mind, we know that if we see people's mental health deteriorating from the service users, we can signpost them to Vita Mind and Hope, where they are held through clinical psychologists, art therapists and various other interventions to support them in improving their mental health.
And in our secondary care and our community services, we've got a fantastic project at our Speedwell Centre, so in central Bristol, where the team there have developed an allotment working in partnership with the local authority and others, and they've really transformed not just the care they've got on offer, but as their team manager described to me, actually it started to define the whole way that the team sees itself.
Speedwell is a very busy area. The allotment that we have on this beautiful site is actually the first one by the gate, so we are right next to the main road. It's really good, easy access for everyone. It is very urban settings, and I think we're trying to create a bit of a oasis where people can just garden and tune into the plants and the soil and do the rituals of doing all the watering and the weeding and just forget about what's going on. The Involvee team in AWP set up work placements and paid opportunities. So I've seen someone who was quite nervous at the beginning, then got really into the project, then started doing extra hours, and then now is getting paid.
Nature-based practice is becoming more recognised as a therapeutic intervention in mental health, and certainly as a trust we're beginning to recognise the benefits to individuals who access our service. It's about working with people in an individualised way and finding their strengths and their interests and using occupation as a therapy really for their recovery in mental health.
Hartcliffe City Farm is a community farm. It's 6.5 acres. We have got sheep and lots of goats, chickens, ducks, guinea pigs, and we're really lucky. It's beautiful, surrounded by the Dundry Hills with a really stunning natural environment for us to do our work. We work with people from all different walks of life. It's amazing the variety of people we have here. I think the shared experience is that people are going for a challenging time with their mental health, and that's really unifying for people. Developing our relationship with clinicians at AWP is really important because they get to know our project, they get to know the benefits of it, and they also get to see the type of people that it helps. We get referrals from recovery navigators and specialist mental health nurses. Once we establish a frequent referral pathway, they get to really understand the benefits of the programme, and that means they can refer people who we know will really benefit, so people who are really isolated, people where purposeful occupation is really important. So our link and our communication with their recovery workers is really important. Obviously people move on, they recover, they go back to work and back into training, so actually having a kind of constant stream of referrals from AWP is really, really important part of our process.
One of the key aspects of our green plan is looking at sustainable clinical care models. Green social prescribing fits in really well with that, in the sense of making sure that we allocate green social prescribing initiatives as a first line treatment rather than a nice to have, and I'm very keen that that's part of the agenda for AWP going forward.
The great thing about green social prescribing being part of a formal programme is that we are evaluating everything as we go and properly assessing the benefit of what we're doing. In my leadership role in Avon and Wiltshire Partnership Trust, one of the things that I really want to see this programme lead to is a fully embedded green care, green social prescribing offer across all of our services. And I really believe that through the evidence we've got, through the training we're developing, and through the hundreds of passionate people that I meet that really want to make this work, I think we'll be able to be an exemplar of including green social prescribing in our day-to-day practice.